Does seminoma always need an orchiectomy? Imagine discovering a lump in your testicle and wondering what comes next. When it comes to seminoma, a common type of testicular cancer, the first step usually involves surgery called orchiectomy. But does every case of seminoma requiring this procedure? Let's explore the facts. In most cases, radical inguinal orchiectomy is the standard initial treatment for all patients diagnosed with seminoma. This surgery involves removing the entire affected testicle and part of the spermatic cord through an incision in the groin. It serves two main purposes: removing the tumor and providing important information about how advanced the cancer is. This helps doctors decide on the best follow-up treatment. For patients with stage I seminoma, which means the cancer is confined to the testicle without spread, orchiectomy alone can be very effective. Studies show that over 85% of these patients are cured with just this surgery. In fact, the cure rate can approach nearly 100%, regardless of whether additional treatments are given afterward. So, for many men with early-stage seminoma, removing the affected testicle might be enough to eliminate the cancer. However, the question of whether further treatment is needed depends on the stage of the disease and individual risk factors. After orchiectomy, some patients choose active surveillance. This means regular checkups, blood tests, and scans over several years to watch for any signs of recurrence. Most relapses happen within the first 2 years, but with careful monitoring, many men avoid additional therapy altogether. Other options include adjuvant treatments like chemotherapy or radiation therapy. Chemotherapy, especially with a drug called carboplatin, has shown to lower the risk of recurrence and is often preferred over radiation because it avoids some long-term side effects. Radiation therapy was once the mainstay for stage I seminoma, but due to concerns about long-term risks like secondary cancers, its use has become less common. For patients with higher risk features, such as larger tumors or evidence of blood vessel invasion, doctors might recommend additional treatment after orchiectomy. This helps reduce the chance of the cancer coming back. When the cancer has spread to lymph nodes or beyond, treatment usually involves chemotherapy, which can still cure most patients. Even in advanced stages, the prognosis remains good with appropriate treatment. It's also important to consider fertility. Before surgery, men are often advised to bank sperm, since treatments can temporarily affect sperm production. Interestingly, removing the cancerous testicle might sometimes improve sperm counts, but fertility preservation is a key step for many men planning to have children in the future. In summary, while orchiectomy is the primary and often curative treatment for seminoma, it does not always mean additional therapy is necessary. The decision depends on the stage of the cancer and individual risk factors. Most men with early-stage seminoma can be cured with surgery alone, but ongoing monitoring and personalized treatment plans are essential. Always consult with an oncology specialist to understand the best approach for your specific situation.